Let's talk about the Lauge-Hansen classification. Lauge-Hansen classification is used for ankle fractures and is based on two things only. First one is position of foot at time of injury, like supination or pronation. And second is direction of force applied, that are adduction, abduction, or external rotation. Now let's talk about the classification. Number 1 is supination adduction. In this type, there is transverse fracture of lateral malleolus and a vertical fracture of medial malleolus. Usually a two-stage injury. Number 2 is supination, external rotation. This is the most common type. In this type, injury happens in 4 stages. Anterior inferior tibiofibular ligament injury, then oblique fibula fracture, then posterior inferior tibiofibular ligament tear or posterior malleolus fracture, and finally medial malleolus fracture or deltoid ligament tear. Number 3 is pronation, abduction. In this type, there is a medial malleolus fracture with syndesmosis injury and a transverse fibula fracture above the level of joint or syndesmosis. Number 4 is pronation, external rotation. In this type, there is a medial malleolus fracture with anterior inferior tibiofibular ligament tear and a high fibula fracture, and also posterior malleolus fracture. Hope you've understood the concept. God bless you all. See you in next video.